This presentation was written by Group 13 for Assignment 2 of Population Health. It is an education module for the staff and volunteers of a local food pantry. This presentation is created based upon educating leaders and volunteers at Community Food Bank of Central Alabama. Were it to be presented to another organization, changes would be made in location-specific data. Welcome to the Food and Population Health Learning module. We're so excited to share with you more about your role in the overall health of Central Alabama. As leaders and volunteers of the Community Food Bank of Central Alabama, you are influential in fighting hunger in 12 Central Alabama counties. Take a moment to think about why working with this organization is important to you. Why did you choose to work or volunteer with Community Food Bank of Central Alabama? There are many reasons that the work you do here is important. Did you know that increasing access to healthy food affects the health of the whole community? Today, we will be learning about how food access and food insecurity intersect with the health of our entire population. By the end of this module, you will be able to define and explain the importance of population health, identify at least 5 different social determinants of health, explain how access to healthy food affects individual and community health, analyze how community policy and social norms influence access to healthy food, strategize ways to increase community awareness and increase access to healthy foods. Let's talk about population health and why it is important. In their article in the American Journal of Public Health, Kindig and Stoddart defined population health as the health outcomes of a group of individuals, including the distribution of such outcomes within the group. In other words, population health focuses on the health of a community as a whole, rather than solely the health of each individual. In population health, we look at the patterns, policies, and interventions that influence the health of the community. Whether the community is as big as an entire country or as small as a tiny rural town, the health outcomes for both the individuals and the entire group will be affected by or determined by several social determinants of health. According to the U.S. Department of Health and Human Services, social determinants of health are the conditions in the environment where people are born, live, learn, work, play, worship, and age. These conditions affect a wide range of outcomes and risks related to health, functioning, and quality of life. Education access and quality affect the preparedness for future work and the ability to earn income, as well as the mental and physical health of students and their families. Economic stability affects the ability to take care of oneself and one's family. From nutrition to living conditions to stress, economic stability or instability has a large influence on both the individual and the community. Social and community context describes determinants including closeness of community members, community engagement, discrimination, religious affiliation, and restrictions such as incarceration. Healthcare access and quality includes access to health insurance, proximity to hospitals, clinics, and pharmacies, and access to qualified healthcare professionals and the necessary equipment to treat and prevent diseases. Neighborhood and built environment determinants include the safety of living conditions, access to parks and playgrounds, transportation, and more. Some social determinants of health are obvious, and others may not be quite as noticeable. Food security is an important factor in the health of individuals, but what are the social determinants of health that lead to communities with high food insecurity? First, we will look at what food security is. According to the American Institute of Nutrition, food security is consistent access or lack of consistent access to enough food for an active, healthy life. This graphic from the Food and Agriculture Organization of the United Nations shows different levels of food insecurities, from access to enough food for an active, healthy life to severe food insecurity. You'll notice on the green end of the chart that it begins with food security as it moves toward more and more insecurity. As one begins to have uncertainty regarding the ability to obtain food, moving into a moderate food insecurity where they're compromising on food quality and variety. A person with moderate food insecurity likely has insufficient money or resources for a healthy diet, uncertainty about the ability to obtain food, and probably skipped meals or ran out of food occasionally. Then, as you move farther to the right, as food quality is reduced and meals are more often skipped, you move into severe food insecurity, where there may not be enough food for a day or more. Someone who has severe food insecurity has run out of food or goes an entire day without eating at times during the year. There are lots of reasons for food insecurity, including the availability of grocery stores, transportation to get food, unemployment, and other expenses. There are many different reasons or social determinants that lead to an individual or household becoming food insecure. In the category of neighborhood and built environment, there are questions such as: is there a grocery store available nearby? Do they have transportation and the ability to bring food home? In the category of economic stability, are they employed? Do they have enough stable income to buy food in addition to paying the other necessary bills? Do they have access to a home with the ability to cook and store food safely? Just like no individual or household exists in a vacuum, social determinants of health affect one another. Let's look at the Smith family as an example. Miss Smith is a single mom who recently became underemployed. When she lost her full-time job, she also lost her health insurance, which led to a lack of access to healthcare providers who would share information about healthy nutrition. Her lowered income meant not having enough money to purchase food and the need to live in a more remote place in order to save money. The location of her new home does not have easy access to grocery stores and lacks other healthy and affordable options. Miss Smith has a high school diploma, but because the unemployment in her area is high, she doesn't have enough education to compete for the limited number of jobs available. All of these things determine her family's level of food security and in turn affect her family's health. As you can see from the example of Miss Smith and her children, social determinants of health interact with one another to impact the health of not only an individual, but of the whole community. Let's talk about the effects of poor diet and food insecurity on an individual. Individuals with higher rates of food insecurity are more likely to have health problems that are caused by hunger, such as lack of concentration, loss of muscle mass, and internal organ diseases. Skipping meals causes the body to start using nutrients from muscle stores for basic bodily functions. Individuals who are genetically predisposed to disease, who do not have access to healthy foods, will not be able to properly prevent diseases such as cardiac problems. The unhealthy food they do have access to also can lead to obesity and diseases that stem from being overweight. Community policies and social norms are closely tied to food security and population health. Communities with predominantly higher populations of ethnic minorities and those with lower income tend to have higher rates of health problems linked to poor diet and exercise due to social determinants of health, including food insecurity. The 2009 U.S. Department of Agriculture report, Access to Affordable and Nutritious Food, Measuring and Understanding Food Deserts and Their Consequences, states that urban core areas with limited food access are characterized by higher levels of racial segregation and greater income inequality. In small town and rural areas with limited food access, the lack of transportation infrastructure is the most defining characteristic. In their study, Food Security, Policy, and Human Development in the United States, John T. Cook and Deborah Frank state, food insecurity is readily measured and rapidly remediable through policy changes, which a country like the United States, unlike many others, is fully capable of implementing. The food and distribution resources exist. The only constraint is political will. Policies around desegregation, zoning of grocery stores and restaurants, placing of affordable housing, as well as policies around subsidizing food and transportation can help reduce food insecurity. So, what can we do to help? Perhaps the biggest thing we can do is educate. We can and should educate ourselves on how our customers are affected by food insecurity and what support they need to have a healthy diet. When we are aware of how social determinants affect reliable food access, we can support the community more appropriately and help to prevent health problems. We can also provide education to our customers on how a healthy and consistent diet affects their whole body's health for the better. This education can include recipes and food storage tips, in addition to information about having a diet that is balanced nutritionally. We can provide a consistent source of healthy food for those experiencing food insecurity so they can get balanced nutrition for themselves and their families. As a food pantry organization, we have the opportunity to place these consistent sources in several local communities, providing both healthy food and steady employment for community members. Finally, in order to eliminate high levels of food insecurity in our state, we need to advocate for these populations at a state and even national level. We can lobby policymakers to introduce and strengthen laws that make healthy food more accessible and provide better options to areas with high levels of food insecurity, including minority and rural communities. Check out these resources for more information on population health, social determinants of health, and food insecurity.